Foreign body aspiration. Young children between 1 and 4 years are prone to aspirate small objects in the airways. Unless recognized and treated promptly, this results in significant morbidity such as recurrent wheezing, coughing, and pneumonia. Immediate response to a foreign body aspiration is choke, gag, cough, or localized wheeze. After the initial episode, symptoms may improve from some time and the whole episode forgotten. Subsequently, the course of the illness depends upon the nature of the foreign body, the size of it, extent, and the size of obstruction. The foreign bodies of organic or vegetable source is going to swell up and cause more symptoms. A partial obstruction may cause a ball valve type effect leading to localized hyperinflation. The overlying chest wall may show hyperresonance, diminished vocal resonance, and poor air entry. In small children, it may be difficult to elicit hyperresonance. Thus, a localized area of poor air entry in a child with a chronic respiratory illness should arouse a suspicion of foreign body, because after the episode of, aspirating the foreign body, the child and the parents are going to completely forget about it. So we have to elicit the history. Complete obstruction and surrounding inflammation may cause distal atelectasis and suppression of the surrounding parenchyma of the lungs. The elastic recoil of the bronchi is lost and the bronchi show segmental dilatation with eventual development of bronchiectasis. In children, incidence of right and left bronchial location of the foreign body is nearly equal. Bronchoscopy should be undertaken if the clinical and radiological picture suggests the diagnosis, even when a history of foreign body aspiration is not forthcoming, because obviously a lot of people will forget it. Foreign bodies are best removed through a rigid bronchoscopy. Appropriate antibiotics are given for secondary infection. So we're going to recap about the foreign body aspiration. Child age is usually between 1 and 4 years, because now is the time where எது கிடைச்சாலும் எடுத்து வாயில போட்டுப்பாங்க. And there will not be a history of foreign body aspiration most of the time, because the child just goes here and there and puts whatever shit it finds in the mouth. And then there will be recurrent wheezing, recurrent coughing, and pneumonia. The initial response will be cough, choking, and gagging, and then there could be a wheeze, but obviously it's going to get dislodged and go into some airways, so the other airway is going to compensate for the respiration, so there won't be any respiratory morbidity perisa. If it's a complete obstruction, there will be distal atelectasis. If it's a partial obstruction, it's going to cause a ball valve type effect, causing hyperinflation, thereby hyperresonance, diminished vocal resonance, and poor air entry. So on percussion, it's going to be hyperresonant, but then the vocal resonance is reduced. That's what they're saying. Okay. And then there could be the elastic recoil of the bronchi is lost and segmental dilatation occur, because if it's going to become chronic bronchiectasis is going to occur. And then bronchoscopy is very much essential, and rigid bronchoscope is helpful to remove it. Antibiotics are given to prevent the secondary infection. That's about the phobo aspiration. Thank you.